Hey all, welcome back to the Real Life Pharmacology podcast. I'm your host, pharmacist Eric Christensen. Thank you for listening today. Today we are continuing on with the top 200 drugs list, and we are already to drugs 16 through 20. Before I get into the 5 medications today that I'm going to cover, I want to remind you, go to reallifepharmacology.com, get your free 31-page PDF on the top 200 drugs. Great study guide, great refresher if you're out in practice. Definitely a no-brainer to have. Simply an email will be all that you need to snag that free resource. So definitely go ahead and get that done at reallifepharmacology.com. All right, so let's get into the drug of the day, and the drugs of the day, I should say. And first one is going to be clozapine. Brand name is Clozaril. And this is an infamous medication that's going to show up on pharmacology exams and board exams without a doubt. So it is an antipsychotic. It blocks dopamine 2 receptors. Its primary use is going to be schizophrenia, potentially bipolar disorder, and these patients are going to be refractory to other agents. And from an adverse effect standpoint, clozapine's got a ton of risks associated with it. And so that's why it's not generally going to be the first antipsychotic selected, is because of some of those risks. So getting into that, boxed warnings, some of the risks associated with clozapine, neutropenia. So this is what requires the lab monitoring for clozapine, so it can cause a drop in white blood cell count, more specifically ANC. So that is obviously going to be needed to be monitored. The next box warning is a significant drop in blood pressure, and I've actually seen medication error with clozapine that ended up in a patient death because the incorrect patient getting the medication, the patient who was taking the medication had schizophrenia for a very long time, and they were on a very high dose. And if you start too aggressively with clozapine, you can actually cause significant cardiovascular collapse, and obviously one of those signs and symptoms there is hypotension. So definitely a good one to remember there, and a boxed warning associated with its use. Seizure risk is also a boxed warning associated with clozapine. There's also been reports and issues with myocarditis, so issues with the heart there as well. And then, of course, the last box warning is the one associated with elderly patients with dementia and using antipsychotics in general in treating behavioral issues associated with dementia. It can increase the risk for mortality. Other adverse effects that I wanted to mention anyway, clozapine definitely has some anticholinergic activity. The drop in blood pressure I alluded to, metabolic syndrome, so it can increase the risk for diabetes, hyperglycemia, elevations in lipids, extrapyramidal symptoms, although clozapine is generally considered lower risk for some of those movement-type adverse effects. It certainly can and has been associated with this medication as well. And then last, I did want to mention QTc prolongation. So again, that's generally in combination with other medications, antiarrhythmics, for example, but definitely something to keep in mind there. All right, let's keep moving. Our number 2 drug of the day is Lasix. So that is the brand name. Generic name is Furosemide, and this is a loop diuretic. So remember, diuretics are going to clear fluid basically from the body, and it does that by sending that fluid out through the urine. Uses, so you could anticipate any type of disease state with excessive fluid is where we're going to use furosemide. So heart failure, just generalized edema, maybe ascites is another good example where you might see loop diuretic like furosemide used. When I'm seeing new starts of furosemide or increased dosages, I'm definitely on the lookout for meds that can contribute to edema. So gabapentin, for example, pioglitazone for diabetes, NSAIDs, amlodipine. These are all medications that can cause edema, fluid retention, those type of symptoms. So pay attention to that. When somebody is needing a new start of furosemide or an increased dose, be sure we go back and look at their medication list and make sure we aren't causing the prescribing cascade. Adverse effects, kind of monitoring. So hypokalemia is a big risk with the use of loop diuretics. Obviously, low potassium goes out with that fluid. That can lead to low potassium, and also lead to other deficiencies in other electrolytes as well. Calcium, for example, magnesium, and some of those. So important to definitely take a look at those labs periodically when we're using furosemide. And then with the electrolytes, I alluded to the fluid leaving the body. So if we run off too much fluid, we can cause dehydration and cause issues with, acute renal failure, impairment, that type of thing. So definitely something important there. Also associated with that fluid loss, bothersome urinary frequency. So that is an important thing, definitely a good patient education thing. It's why we generally tend to take furosemide a little bit earlier in the day, so we make sure we're not up all night going to the bathroom. All right, moving on. Drug number 3 is vardenafil. Brand name of this medication is Levitra, and this is classified as a PDE5 inhibitor, and this is used primarily for erectile dysfunction. If you remember the ending, so vardenafil, sildenafil, so that denafil ending, that's going to notify you that it's likely a PDE5 inhibitor. So definitely one you can pay attention to there, and if you don't necessarily know, the name of the drug, you might be able to catch that ending and recognize that it's a PDE5 inhibitor used for erectile dysfunction. From an adverse drug reaction standpoint, it can drop blood pressure some, so that's something to pay attention to, particularly as our patients get a little bit older. Maybe they're at higher risk for falls. Could be an issue there. Flushing definitely has been reported. Headaches can sometimes happen as well with the use of vardenafil there. And then one of the most highly testable things probably with this class of medication in general is the drug interaction with nitrates. So your isosorbide, mononitrate, dinitrate, those type of medications can certainly have an additive type effect, can cause some profound hypotension, so low blood pressure. That can be really, really problematic. So it's recommended to avoid the use of nitrates concomitantly with a drug like vardenafil. Number 4, tetracycline. So this is a tetracycline derivative. I guess it's considered, in that class as well. If you think about, doxycycline, minocycline, those are other medications within that class. It inhibits bacterial protein synthesis, the ribosomal subunits, 30S and 50S. It can bind those up and basically, like I alluded to, block that bacterial protein synthesis so they can't reproduce and function normally there. Uses, acne is something I have seen it used in. I guess that's maybe not necessarily considered an infectious disease type of situation, since tetracycline is classified as an antibiotic. But I've always remembered, the tetracyclines, and maybe more specifically doxycycline, but it has a whole bunch of unique uses. So if you're ever on an exam and you see some weird infectious disease bacteria and they're asking you what's used to treat it, I always remember thinking, okay, tetracycline, doxycycline, like that's probably a good guess if you're not really sure there. So things like bubonic plague, syphilis, can be part of like H. pylori treatment for the management of bacterial stomach GI ulcers. So again, lots of kind of unique indications for the use of tetracycline there. Adverse drug reactions. So photosensitivity is definitely one I educate patients on, definitely one you might see on a board exam there. So again, increased risk for sunburn, things of that nature. So, depending upon where you're living and when you're living there, time of year you're living there, that patient education certainly may vary a little bit, but definitely recognize that it can increase the risk for sunburn. Other skin reactions are definitely a possibility as well with tetracycline. GI upset, nausea, vomiting, diarrhea can happen as well. And I would say that's true probably of virtually all antibiotics in general. One unique thing it's recommended to avoid using in patients less than 8 years old, and that is because it can cause tooth discoloration as well as bone growth suppression. Okay, so very, very important to remember that their teeth can actually become a yellowish type color if we give it to patients who are too young. So definitely could be a bothersome, problematic issue as a patient ages there. So definitely remember that little nugget of information. And then last but not least with tetracycline, I did want to mention binding interactions. We've got calcium, we've got iron, we've got magnesium. All these type of cation supplements can bind up tetracycline and basically block the absorption of the drug. So we're not going to get adequate concentrations to potentially treat our patient if we're using it for an infection. All right, last but not least, our fifth drug of the day and number 20 is heparin. Heparin is an anticoagulant. It is an injectable anticoagulant. It inactivates thrombin and blocks conversion of fibrinogen, to fibrin. And ultimately it has antithrombotic action. So you're basically, preventing the formation of thrombosis is what we're using this medication for. From an adverse effect standpoint, obviously bleeding risk is a big issue there. Another kind of nugget associated with heparin is protamine is the antidote. I've certainly seen that come up on pharmacology exams and NAPLEX and board exams and things of that nature. So definitely pay attention to that one. And then the unique thing really with heparin, there are a few kind of wacky adverse effects, can impact potassium levels, for example. But heparin-induced thrombocytopenia is definitely something that's taught quite a bit. It is somewhat rare, but certainly does happen periodically in practice. What's going to happen is you're going to see a drop in platelets. Usually it's in the neighborhood of 50%, maybe 30 to 50%. And in most reactions, it's going to be kind of a little bit of a delayed onset. You're going to see that drop in platelets probably in the 5 to 10 day range. Okay, so typically when we're using heparin, it's probably in an inpatient type situation, or the patient's at least getting lots of healthcare touches where they're seeing a provider somewhat frequently. So again, monitoring those platelets is going to be important, making sure that we're not seeing that drop and risking heparin-induced thrombocytopenia, or at least catching it sooner. So again, heparin-induced thrombocytopenia, it's an immune-mediated reaction, and it's basically the immune system, IgG, binding to kind of heparin complexes in the blood there, and then the immune system basically disrupting that and causing thrombocytopenia. But these kind of clumps, if you will, can actually cause thrombosis. So again, that's kind of like a clot blockage formation. And that can be an issue with heparin-induced thrombocytopenia. So, with heparin, you usually think, well, this thins the blood, it's going to cause bleed risk. Well, in this unique case, heparin-induced thrombocytopenia, we can potentially run into the issue of thrombosis. So definitely a good thing to remember there that may come up on your board exams. Speaking of board exams, if you're preparing for BCPS, NAPLEX, ambulatory care, geriatrics, we've got a growing list of resources at meded101.com/store. Please go check them out, support the sponsor. You get some great resources. We've certainly helped thousands of pharmacy students pass their board exams over the last several years. So go support the sponsor, meded101.com/store. If you're pharmacy technician, nurse practitioner, med student, prescriber at all, we've got a bunch of books as well. Case studies, clinical pearls, polypharmacy, all sorts of different stuff that can definitely help you kind of hone your practice no matter what practice you work in. As long as you're prescribing, using medications, we can definitely, I think, help provide you some education, if not definitely some good reminders of things that I've seen in practice in some of those books. So again, all those links you can go track down at meded101.com/store. And of course, go snag your free 31-page PDF on the top 200 drugs. Definitely a no-brainer to take advantage of there. Simply an email is all it'll cost you. If you want to track me down, suggestions, comments, mededucation101@gmail.com. Feel free to do that. If you have a second, please leave a rating and review on iTunes or wherever you're listening. Greatly appreciate that. You can also connect with me on LinkedIn if you have any requests, consults, those type of things. I definitely do some of that work as well, so don't hesitate to reach out to me with your ideas and various projects there. So again, mededucation101@gmail.com. Well, I'm going to sign off for today. Thank you so much for listening. Hopefully you picked up a few practice pearls or maybe at least a few refreshers, and I hope you have a great rest of your day.